Member for Melton.
Thank you, Speaker, and I rise to contribute to this very important debate on voluntary assisted dying, Amendment Bill 2025. And firstly, I would also like to acknowledge the member for Pakenham's contribution. It was amazing and I thank her for it. But I also want to commend the Leader of the Opposition for his contribution and the personal stories that he told and of course his change in regard to his position on the bill. And I think the most important thing that's been raised today, and that is it is a personal choice. It's an individual choice. No one's right, no one's wrong. It's about their body, it's about their life, it's about their choice, and we should not interfere with someone choosing what they would like to do at end of life, whether that's live it out till their last breath or whether they think they want to reduce and stop the suffering, and it is a personal choice. Of course, many members of this place would know back in 2017 we saw the passage of the Voluntary Assisted Dying Act, and this Act led the nation in offering a safe, compassionate and dignified end of life choice for those suffering from a life of limiting illness. In the 8 years since this Act came into force, many of the other states obviously have followed Victoria's path and introduced their own voluntary assisted dying models, and they have taken the Victorian legislation and made it their own, and even so improved on the original legislation. And that has since left the Victorian legislation in need of some important adaptations to catch up to the rest of Australia. Of course, when the legislation was passed in 2017, we didn't stop listening or learning to better improve this Act for Victorians. And importantly, we've listened intently to people with lived experiences, with the families of people who have accessed VAD, to the clinicians, advocates and people and organisations that oppose VAD. And of course, all these discussions have been had with respect and compassion, and that's really important. And it remains essential that the discussion here today remains with respect and compassion of people's individual position on this important bill. So since 2017, 79% of the patients that have both applied for and accessed VAD have been in palliative care. Palliative care is an essential provision, and we all know that. And the integration of palliative care options remains an important aspect of the end-of-life care delivery model. And in 2024-25, 75% of applicants were accessing palliative care when they first requested VAD. And this suggests that VAD is being appropriately accessed in conjunction with palliative care rather than as an alternative to it. And it's not an alternative to it, it's part of the continuum of care. And since 2017, there have been more than 2,700 permits issued to prescribe self or practitioner administration of VAD substance, and 1,683 deaths from administration of VAD substance. And of the 2,700 permits that were given, 32% of those applicants with a permit died without administration of a VAD substance. So obviously their life ended before they could action taking the VAD substance. So these people who chose to access VAD to end their pain and end their suffering, they didn't want to live with the pain anymore, and so they should be able to decide when they have had enough and are ready to end their suffering. And again, I come back to what the Leader of the Opposition said and what others have contributed, and that is it's the individual choice. And of course, these decisions are theirs to make. As other VAD laws have been rolled out across the nation, there has been no evidence of coercion in our Victorian experience, or any other state. No evidence has been provided in regard to coercing a patient into accessing VAD. It's not a choice between life and death. Rather, it's an additional end-of-life option for those who are already dying and want to end their pain and suffering. It should be seen as a continuum of care, and it is a continuum of care. It should be obvious that these choices are not made lightly or without great consideration of all options. Of course, the 13 proposed amendments that are before this House are designed to improve equity of access, improve the practical experience of those patients and families navigating VAD, and improve safety for all involved And finally, but still importantly, improve the administration of the scheme. Of course, allowing registered practitioners to initiate discussions has been one of the issues that have been raised in concerns. And of course, humans innately struggle when it comes to talking about death. Whether it boils down to death being a primal fear or it's simply too overwhelming to even think about, humans struggle to talk about death, even if we are already suffering from a life-ending illness. It's taboo, but that doesn't mean it should be. Some of these discussions about our own end of life may be some of the most important conversations that one will have, especially if we do become unwell and want to make sure our wishes are known to those around us. And it is important that we talk to our family members early on if you are diagnosed with a terminal illness. Dealing with death has changed over the years, and I remember when I first started as a paramedic and we attended to someone that was either dying or had died, it was almost taboo. The person would be put into a bedroom, doors would be locked, family members would not attend to the body and sit with the family member that had passed away. As a paramedic, we would load that patient up and take them via a public hospital for certification of death and then off to the city morgue. And I'm pleased to say that that's all changed now. We've become more compassionate and a way of dealing with grieving in a better way, where we encourage family members to sit with their family member that's passed away. And paramedics no longer transport people to public hospitals for certification and then off to the coroner's court. It's all done through the police, and you ring the private undertakers that will come and pick up the body and work with the family. It's a much more humane process. So the first proposed amendment that I will talk to will allow registered health practitioners to initiate discussions with patients about VAD, rather than waiting for the patient to raise it first. This not only can ensure that the patient is aware of all their options, but this is also about information sharing by practitioners to their patients. It may also even speed up the process for some who may have not been aware of all of the options available to them in regard to their issues. So the amendment will further empower the patients and hold on to a level of autonomy and agency over how they wish to move forward with their life. Nothing is being taken away from those patients. They will still be able to refuse VAD if it is raised with them from their practitioner. But it still provides the patients with the information on all of the options available for them, and they can decide what is next for them. It is the patient's choice, and their choice only. No one else's choice, not their family. It is the individual's choice, not their practitioner. No one else around them can choose for them to access VAD except for the patient. So, of course, this proposed amendment is in line with WA, Tasmania, Queensland, New South Wales and the ACT, and it recognises that VAD is part of healthcare and arguably one of the most important healthcare discussions a patient can have with their practitioner and with their family. And this amendment will allow for enhancing safe, compassionate and dignified end-of-life choices for those who continue to suffer from a life-threatening illness. Of course, conscientious objection has been another issue that's been raised, and VAD discussions encompass more than just the patient themselves and their families. The health practitioners also play a vital role in the discussions. For those who choose to conscientiously object to provide VAD, should be able to object and refuse to provide VAD as well as provide information on VAD. And this amendment respects and protects the autonomy of the health practitioners also. And maybe it's the tabooness of death coming into play or other valid reasons for not wanting to be involved in the VAD process. Nonetheless, this amendment will bring the Victorian legislation into line with other Australian jurisdictions. And other than the minimum information of VAD to patients, that being the contact information for the statewide care navigator service and relevant department website. So any practitioner who objects to this process will not be compelled to do any more. So again, it's just about providing the statewide care navigator service and the relevant department website. It's not about coercing their patients, it's not about informing their patients, it's just telling them about that information. This is an important bill, and I commend this bill to the House.